Yeah, I just wondered whether, talking a little bit about the vulnerabilities of the supply chain that have maybe been highlighted in the last year and a half, we've seen governments move towards strengthening their efforts to build local manufacturing capacity. I wonder whether you could talk about this from the Indian perspective, and then maybe Adrian and Jonathan from the European and US perspectives as well.
It is very, very important because during the pandemic time, the issue which was raised is, should everyone start producing the products in their own markets? And should the local country patients are more important than anywhere else? So there were restrictions which are imposed in some parts of the world. However, it is important that we need to realize is based on the theory of competitive advantage, that you can't produce everything in every part of the world. It will raise the healthcare cost. And what is important is the diversified supply chain. There should not be one supplier for the product. The product should be available from multiple places, so the dependability from one source gets reduced. Hence, it is not localization from supply chain which is important. It is the diversified supply chain which is very important. And that is our position as far as India is concerned. And IGBA position.
And in the EU and the US, is there a similar viewpoint on that?
Yeah, I did. This is for Europe. I think indeed, obviously, as Sudarshan pointed out, we had immediately huge surges in demand for certain medicines due to COVID, and I think the industry reacted very well. Indeed, there was a lot of collaboration between the industry and governments, around things like regulatory flexibility and things like that. But there was also a huge amount of international cooperation between us through the IGBA and with the WHO as, I guess, the kind of international regulator, where we pursued similar initiatives. So I think that actually worked very well, because although we had a lot of surges, in almost all cases, our industry was able to respond, even in cases where we thought at the beginning we would not be able to. We were able, through these processes, let's say, to meet those massive surges. Just to give an indication, okay, for some drugs, the increase in demand was 900%. That's 9 times the normal demand, okay? That's not something that you have lying around in stockpiles, let's say in wholesalers or what have you. You have to produce this. So I think that's key. Going forward, I agree with Sudarshan. I don't think it makes sense for any country or any region, if you wish, to try and produce absolutely everything. What we can do to increase diversity of production, of course, makes a lot of sense. And I think here we're seeing this. So there's been a certain rebound of manufacturing here in Europe. There's an interesting discussion between our industry and the European Union about how to kind of encourage that going forward. I think one of the key things to underline here is that a lot of governments think that by snapping their fingers, this is going to happen, when in reality, this will all require investment by the private sector. Even where there is some support for technology or this kind of thing from government programs, the overwhelming majority of the investment is going to have to come from the private sector. And for the generic industry, for our industry, I mean, the real challenge is that the markets are currently designed to drive prices as low as they possibly can go. And of course, that's not compatible with a diversity model. So I think we have to have sustainable market models that encourage those investments in greater diversity. And I hope closer cooperation. I think certainly for IGBA, and Jonathan will talk more about that, we're looking at a future world where we can cooperate more, EU, US, India, and all the members of the IGBA, to ensure good trade flows, even in crisis situations. I'll stop there.
And from the US perspective, I think the debate has definitely evolved. Last spring, you saw a lot of discussions on really both sides of the political aisle, Republicans and Democrats, who are thinking, could we bring back all pharmaceutical manufacturing in the United States? Clearly, that was not a realistic debate and discussion. And I think we've evolved to a place where there's a real recognition, again, from the Republicans and Democratic parties, that we operate in a globalized world, and our pharmaceutical supply chain in the United States is most secure when we're relying and partnering with our allies for that globally diversified supply chain. And so even in the Biden administration's report that came out last month, looking at the sustainability of the pharmaceutical supply chains in the United States for both finished dosage and API. They identified ensuring that our allies have resilient supply chains as a key policy objective for the Biden administration. So I think that globally diverse supply chain, there is recognition of the value of that. And not only by government, but I also think truthfully by our industry as well. In one sense, the tension that Adrian identified is real. I mean, the market drives prices down, but at the same time, there is increased market demand for what is viewed as a diversified, secured supply chain. And so how that gets worked out in the end through both government interaction, as well as if there's a way that some private sector actors are going to increase the value they place in that diversified supply chain, I think will play instrumental in how this works out in the end. But the market dynamics right now and putting pressure on bringing the lowest price for particular commoditized generic products into the marketplace makes it very difficult to have this diverse supply chain, as Adrian again had pointed out.